Evidence-based practice researchers have suggested using antimicrobial ointments with our CVC care. During these studies, they found that by implementing the ointment along with your dressing changes during the treatment, that the amount of infections that those particular patients acquired was reduced by 15%. Currently on my unit, we don't use an antimicrobial ointment. We don't use an ointment period with our CVC care. Basically, we clean around the site with ChlorPrep, which is that chlorhexidine solution. Most patients tolerate it well. For patients that don't, we may just generally use alcohol swabs to clean around that area. Some patients prefer the Aeroself, which is another solution that we use on the unit. It's a little less irritating to the skin. We cover those sites with a 2x2 gauze, and then we make sure to seal the catheter site inside that gauze by going around the perimeter with tape. Some of the patients are allergic to the regular paper tape, so they bring in their own tape, but we make sure to seal that site so that there's no moisture going in. We try to educate our patients on the importance of just sponging off around that site. You don't want your dressing to get wet. You don't want your site to get wet. So that's the policy and procedure in place for my particular unit. We don't use the ointment, but we do use the chlorhexidine, the ChlorPrep swabs. More research from a management point of view concerning policy and procedure in place in various settings found that when staff collaborated with management, there was more of a compliance with current policy on the behalf of the staff. They felt like they were involved in the policy and procedure making process. They felt like their concerns were taken into consideration when making policy and procedure. As stated before, you have to consider work stressors, the acuity of the patients, the staffing available. All of those factors play a significant role in the compliance of staff. If you're saying that, staff needs to wash their hands with soap and water while on the unit in between patients, but you don't have sinks readily available on the unit, you don't have soap readily available on the unit. Although those things may seem minute, they play, a big role in maintaining patient care as well as being time efficient during patient care. Patient education is always a important factor in patient treatment. A survey was taken amongst hemodialysis patients, and the end result was that patients felt like if they were educated more on different factors of their treatment, they would be more inept to comply to the treatment plan, to show up for their hemodialysis, to use those strategies that we have taught them out in the community to prevent themselves from acquiring more infections. As well as education in general is always a good route to go when trying to maintain the compliance of your patients. So not every patient has a health literacy. Some people think, well, I ran my hands under the water, that was good enough, I dried them off. You have to teach your patients, the importance of that friction, using soap, making sure that you wash your hands long enough, making sure that you're being careful when you're touching different surfaces, when you're going from person to person, just to protect yourself as well as the people around you. By implementing the strategies previously discussed, the patient education on infection control, as well as keeping their immunizations up to date, educating your staff on the importance of infection control, involving them in the policy and procedure making for the unit, factoring in all the stressors that occur during the workday. The change can be seen and evaluated by noticing, is there a decrease in the amount of infections that we're seeing in our patients? Are we seeing more compliance with the staff on the unit? Does the staff feel like, you know, they're involved in policy and procedure making? Are they more satisfied with their job now that they're being involved in the process? Those are factors that you can use to determine how well new policy and procedures are going, as well as to see what else is it that may need a change. Is there something that we could tweak a little bit more so that we can see positive patient outcomes? In essence, infection control is important regardless of the healthcare setting. Our patients are coming in experiencing end-stage renal failure along with their chronic comorbidities. So we want to make sure that we're not introducing new infection to them, new problems that may occur with their health. We want to make sure that we're doing our part, as well as by not only educating the staff but educating the patients. You create this system of accountability for all parties, which in essence is bound to bring about patient positive outcomes. Thank you.